Hello dear students, we will talk about the sternum today. So in the sternum we have the mandibular sterni, the body of the sternum and the xiphoid process. The sternum articulates with the thoracic part of the vertebral column by the upper 7 pairs of the ribs and their costal cartilage. In addition, the mandibular articulates with the sternal end of the clavicle on both sides. The mandibular sterni, it is roughly quadrilateral, broad and thick in the upper part, and it lies opposite the bodies of the third and the fourth thoracic vertebra. The upper border presents a jugular notch, also known as a suprasternal notch, in the center and over-articular facet on the sides for articulation with the sternal end of the clavicle. So, when they articulate, they form a joint known as sternoclavicular joint, which is a saddle-shaped synovial joint. Around the border of this joint, we will have attachment for capsular ligament. Anteriorly, it will give attachment to the anterior sternoclavicular ligament and posteriorly to the posterior sternoclavicular ligament. The jugular notch will give attachment to the interclavicular ligament, and the anterior margin and the posterior margin will give attachment to the deep cervical fascia, to the investing layer of the deep cervical fascia, forming a space above the jugular notch known as the suprasternal space of Burns. The lower border of the mandibular articulates with the body of the sternum, forming a cartilaginous mandibulo-sternal joint, and this joint corresponds to the lower border of T4, and it forms an angle known as the sternal angle because the planes of the mandibular and the planes of the sternum are not at straight lines. The sternal angle is also known as the angle of Lewis, and as you can see, there is a demifacet on the lower end of the mandibular and the upper end of the lateral border of the sternum, so they will form one full costal facet which will articulate with the second rib, costal cartilage of the second rib. So the sternal angle will correspond to the second costal cartilage, and this will help in counting the number of ribs, Now the lateral border, on the lateral border we have one costal facet, one articular facet for the articulation with the first costal cartilage and forms primary cartilaginous joint. Below here, as I have mentioned, this is the demicostal facet, which along with another demicostal facet of the sternum forms a joint with the second costal cartilage, and this is a synovial joint. All the joints formed by the costal cartilage with the lateral border of the sternum will be synovial joint, except the first costal cartilage. Below the articular facet, in between the articular facet, this curvature or the lateral border, on the lateral border, will form the anterior end of the first intercostal space, and it will give attachment to the anterior intercostal membrane and intercostalis intima. The anterior surface will give attachment to the pectoralis major muscle, and on the superior side it will give attachment near the sternal heads. It will give attachment to the sternal head of the sternocleidomastoid muscle. The posterior surface is concave and forms the anterior boundary of the superior mediastinum. on each side it will give attachment to the sternothyroid sloping downwards, and near the clavicular notch it will give attachment to the sternohyoid. The relations of the posterior surface is it is overlapped by the anterior margin of both lungs and the pleural sac. Beneath this, here on the lower end, it will be related to the arch of aorta. Coming to the mediburum sterni, the body of the sternum. In the body of the sternum, we will have, it is as you can see, it is longer and narrower and thinner than the mediburum, and it is formed by fusion of 4 sternal segments, also known as sternibri, and they will lie opposite the 5th to the 8th thoracic vertebra. The width of the body varies due to the costal notch. It is broadest at the level of the 5th costal cartilage and then gradually tapers below. The length of the body is twice the length of the mediburum in males, and in female it differs. Sometimes the sternal foramen is present between the 2nd and 4th sternibri due to defect in ossification, and it does not have any clinical significance. The upper end is over and articulates with the mediburum, forming the mediburosternal joint, and the lower end meets the xiphoid process at the xiphisternal joint, which will correspond to the intervertebral discs between T8 and T9 vertebrae. Each lateral border has 4 costal facets, 1, 2, 3, and 4 costal facets, which articulates with the 3rd to the 6th costal cartilage. Close to the upper and the lower end, we have demicostal facets, which articulates with the 2nd and the 7th costal cartilage. The anterior body of the surface is particularly flat and faces slightly upwards. There are 3 transverse ridges between the sternibri. There are 3 transverse ridges between the sternibri, and it will give attachments on both sides to the pectoralis major muscle. The posterior surface is slightly concave, and it usually presents 3 faint ridges. It gives attachment to the sternocostalis muscle, and it is related to the pleura on both sides, and on the left side it is related, left lower side, it is related to the pericardium.